Good afternoon. I'm Beth Brockland, the Senior Director at the Financial Health Network, and I'm so thrilled to be here with you all today for this discussion about the workplace of the future. The economic disruption caused by the COVID-19 pandemic cannot be overstated. Today, we'll discuss the impact of the economic crisis on workers and on businesses, and how the pandemic could forever transform the way in which we work. I'm joined for this conversation by Adrian Haro, Chief Executive Officer of the Workers Lab, Jamie Calamarides, President, Prudential Group Insurance, Ling, Global Human Resources Chief Administrative Officer for JPMorgan Chase, and Adam Roseman, Co-founder and Chief Executive Officer for Steady. Thank you all for joining us today. We're so thrilled you're here. Before we dive in, I just want to encourage participants to use the chat function on the Emerge Live site. We have a lot of discussions we want to cover, a lot of topics we want to cover today, but if we do have time at the end of the session, we will certainly welcome audience comments and questions. So again, thank you all to our guests for being here, and let's dive in. So to begin, I'd like to ask each of you to briefly introduce yourselves and your organization, and in a couple of sentences, share with us how you're thinking as you think about the economic crisis and the impact on workers and the eventual economic recovery. What's keeping you up at night? We'll start with you, Jamie.
Yeah, Jamie Calabrese. I'm the president of Prudential Group Insurance. We provide employee benefits for employers and associations and their members to improve individuals' financial wellness. And what's keeping me up at night is the needs of workers before the crisis and after the crisis about the future of work. Before the crisis, we heard stories that workers were concerned about losing their jobs to technology. Our research actually shows that workers aren't afraid of technology, but want instead access to skills and tools to upgrade. And Prudential has implemented programs to do just that, that I'm happy to talk about. After the crisis, what we find is that 6 in 10 workers don't think that work is ever going to go back to the same way it was. And workers are looking for, from their employers in particular, information on health and safety because they trust them. And they're looking for enhanced benefits, specifically around paid leave. And we think that there's a business case for employers to offer paid leave. Happy to chat about both more.
Great. I'll go to you next, Beth.
Thank you, Beth. It's really glad to be here. My name is Ling. I am, my day job is really doing quite a lot of things on the human resources side. And I think for this pandemic, in the past couple of months, my job turned into a full-time COVID crisis management and also prepare JPMorgan Chase to return to office in an orderly manner. For what's keeping me at night, I think it's really about uncertainties. Probably like many of you, there are just so many certainties that we're all dealing with, right? Whether it is the pandemic itself, the emotional well-being side, especially recently, the huge impact around the racial diversity and the gaps that we see. I just think there's a lot of uncertainties that we're all searching for. It's not exactly clear yet in terms of how the future will unfold. So that's probably what keeps me more up at night.
Thank you, Beth. Adam, let's go to you next.
Yeah, hi, I'm Adam Roseman, CEO of Steady. We are a data-driven business focused on helping low to moderate income workers to improve their earnings potential. What keeps me up at night right now, unfortunately, are legislative milestones, specifically July 31 with the expiration of the CARES Act, in addition to the expiration of businesses' ability in exhausting PPP loans. Mm-hmm. And if you look in particular at our worker population, that's been the only thing that's been keeping them alive and afloat. And so what happens next, right? We see jobs are not returning, even in the states that have reopened. We see that across our worker population. So for me, it's really the scariest thing is what happens after those legislative milestones.
Thank you, Adam. Adrian.
Hi, everybody. My name is Adrian. I'm the Chief Executive Officer of the Workers Lab. Our purpose is to give new ideas about increasing worker power, a chance to succeed and flourish. I'm really grateful to be on this panel. In terms of what's keeping me up at night, honestly, Beth, it's my mom. My mom is a seamstress, and she runs a little cleaners in East Los Angeles. And she hasn't been able to work for about 5 months now. And I know it's taking a toll on her financially and emotionally as well. And so it's my mom, but it's all the hardworking Black and tan people like her in immigrant communities all over the country, right? Who are getting a pretty tough shake at the moment. And so their health and their safety, worrying about their recovery keeps me up at night.
Thank you, Adrian. Wow, so you all have brought up a lot of important issues that I think we'll have time to dive into. Thank you for sharing. It's just helpful to understand, what's top of mind for you as we begin this conversation. I want to go back to the comment that you made first, Jamie, about the future of work. That's something we've talked about a lot. We were talking about a lot before the crisis, and I think most people, when they think of the future of work, they think about the need for reskilling in the face of increasing automation and technology, the need to prepare workers for the jobs of the future. I know this is, as you mentioned, this is something that Prudential has been focusing on. You've been thinking about this for your own workforce. So I'd love to hear a little bit more about what that looks like, how you've been working on this internally at Prudential, what some of those efforts have looked like, and how that might be changing, how you might be thinking about it differently in light of the crisis.
Yeah, so when we think about Prudential's top priorities, the future of work is among our top 4 priorities. Inclusion and diversity is as well, and that's especially relevant in today's environment. Before the crisis, we did research and we started investing in the future of work. And the research pointed out that only a quarter of individuals were fearful that their job would be replaced by technology in 5 and even 10 years. And that 75% or more felt that they could use technology to augment their existing work, and that they wanted to get new skills and new capabilities to be able to respond to the future. And so what Prudential has done is we've put in place a new platform that allows individuals to assess their current skills and gaps relative to the needs of the future, to match their current skills to aspirational positions, to search for new roles, and to have new roles come to them, and then get targeted training suggestions around agile, cultural communication, data fluency, software development, strategic thinking, whatever the new skills are that they need. And we're finding that 80 to 90% of our employees are taking advantage of this new capability. And this is allowing us to pivot our employee base toward the future. It also allows us to be able to assess and attract and retain great talent. Now, after the crisis, though, as I mentioned, our additional research suggests that an enormous proportion of the population thinks that work is never going to continue the way it was in the past. When we've done a survey of our workforce and asked them when they're able to return to the office, do they want to? The vast majority say they enjoy the flexibility of being able to work from home and being able to manage their own hours. Yet they also want information on health and security, and they want additional help on financial wellness. And I think this is the thing that ties us all together, and that is the workplace is the source of income. The workplace has an opportunity for purchasing power and fiduciary oversight, but some things don't work in the workplace in this sort of disrupted environment. How do we create an environment that's sustainable and that covers all workers in a way that they can have financial security, be focused on their jobs, bring their whole selves to work? The thing that we've also done, and my colleagues mentioned it in particular, is, although it's different from the future of work, it's actually integral. And that is Prudential has absolutely committed to an anti-racist set of morals and not tolerating and actually preventing discrimination in all its forms. And these two things are actually closely linked, because if we want the workforce of the future to be productive for our society, for companies, for their individuals, we've got to have equity across the workforce, and we have to have equal access as well.
Mm-hmm. Thanks, Jamie. I think there's a couple of key points that you made there that I'm going to want to come back to later in the conversation. The point around health and safety and the needs for workers, the workforce to look different when we return, if and when we return to the office environment. And then this theme of diversity and inclusion and racial equity in the workplace is a theme I want to come back to. But first, Adam, I want to turn to you. You spoke about the legislative proposals that are keeping you up at night, the legislative changes that are keeping you up at night. What do you think that policymakers should be doing now in light of these broader trends around future of work that has been accelerated by the crisis?
Yeah, unfortunately, my list is endless, and my list would have been quite long prior to the pandemic, and now it goes on and on. I mean, I think the first thing they need to do is they need to listen to the workers, and they need to understand the reality of what workers are facing. Adrian's mom, right, who we talked about at the beginning of this presentation, right? There are tens of millions of individuals that are like Adrian's mom across the country right now. Didn't raise as great of a son, but tens of millions of Americans who are facing those same challenges. So, we see again in our data, right, because we have bank account connectivity to our members, and we focus, very heavily on understanding how they earn, looking at their bank account data. It's troubling, right? I mean, the Financial Health Network has done so much research even prior to the pandemic on, the percentage of the American working population that didn't have emergency savings, right? The only reason that those emergency savings aren't dwindled and that people aren't out on the street right now, again, are the things that I talked about at the beginning of this session. So for me, coming into COVID, there was this discussion around things like UBI, right? Which I thought it's a great concept, but there needs to be a lot of work done to make sure it's going to work, just given that once you go there, it's hard to go back, right? And so now my belief is there's no other choice, right? I mean, effectively, if you look at what the CARES Act has been in its first iteration with the $600 of supplemental weekly unemployment insurance, that is UBI, right? And if you look at what's going to happen post July 31, either we're going to have to extend that in some capacity, or we're going to be left in a position where millions of families are going to wake up, most of which, as we've surveyed our members, don't have any clue that $600 expires. And those specifically who haven't been on unemployment in the past, that $600 expires as of July 31st. We're going to come into August, that first week of August, they're going to get a $300 unemployment check or a $350 unemployment check instead of $950, right? And I think from my perspective, all hell's going to break loose. And so from my perspective, first things first, we need to take care of that July 31 deadline and make sure that there is going to be some type of an unemployment supplement. For us, we also focus tremendously on non-W-2 workers, right? 1099 workers, and under the PUA right now, pandemic unemployment assistance. Those workers are able to qualify for unemployment for the first time through December 31. They'll be subject to the lower unemployment as of July 31 that W-2 workers are, but they still qualify for that now. I think the second thing that needs to happen is we need to work towards a way to fund making that permanent, right? Because you have a scenario with W-2 workers where employers contribute into funding unemployment for those W-2 workers. There's no one to fund the 1099 workers today. So how do we solve for that, right? Just given that close to half of the US workforce, those individuals that we have on steady, even if they're not full-time 1099 workers, so many of those hourly W-2 workers have lost their 1099 supplemental income, and that's a big problem. So that's, before anything else, we've got to tackle that.
Thanks, Adam. Adrian, I want to turn to you. The Workers Lab, you support innovators. And so I'd love to hear you talk a little bit about what you think the role of innovators, and in particular, the innovators that you work with that are really supporting worker power, can play in supporting workers to take advantage of the trends, around the future of work and the opportunities, but also obviously in this moment to mitigate the negative impacts of the crisis.
Sure. You know, as a lab that's comprised almost entirely of queer first-generation people of color, we tend to think about spurring innovation in service of increasing power for low-wage workers, of which half of all Americans work in these jobs, right? And I don't think innovation is often associated with that group of workers and with that group of folks. For us, there's like this misconception about innovation, Beth, that it is only suited to solve problems for workers in the 21st century, in gig, in tech, in digital. But we believe that innovation can and should help ensure that the gains of the 20th century extend to all workers. Indeed, many workers were intentionally cut out of the major laws and systems that govern work in this country, right? You can point to agricultural workers, people with disabilities, tipped workers, domestic workers, right? So nannies, house cleaners, the ladies who take care of grandma, right? And even queer people, who this week the Supreme Court, thank God, finally said could no longer be fired on the basis of their sexual orientation. And so innovation and technology in particular can and should be used to right these wrongs. You know, Jamie talked about this and I agree. You know, another myth is that technology is the devil, and technology as we see it is not the devil. The devil is really in the intent behind how that technology is used, rather than simply, you know, replacing human labor. We believe technology can really augment it. And the example I like to give is that like the same technology that generates the unsteady and unpredictable schedules that like wreak havoc in retail workers' lives, as it turns out, is the same technology that can create very steady and very predictable schedules in their lives. And so for us, it really does come down to choices. People in power making choices about whether to use innovation or technology for good or to use it for bad. And as it pertains to the crisis, Beth, we've never been here before, right? So as a lab whose primary job is to learn and to source ideas, we're about to put out a big call for ideas from folks about how they're innovating in service of keeping workers healthy and safe. The pandemic is forcing us not just to imagine what makes the workplace of the future healthy and safe, but how we get there, right? And a critical consideration is like, who has power in that future? Are workers going to have power in that future? You know, in the absence of a robust federal response that Adam spoke about, where, we're curious, like where, how, who is creating these kinds of tools? Because it can't just be masks, right? So who is reimagining what the workplace of the future looks like, and not just in the C-suite, but like in farm fields, right? In restaurants and in retail. Are employers, both private and public, honoring their obligation to keep their workers safe and healthy? In what communities? Where are workers fighting for their own health and safety in the absence of that federal response, right? And so the Workers Lab exists not only to source and to give this kind of innovation a chance, but to learn from it and to put it in front of those people with power who are making choices about work and about workers in the future.
Thanks, Adrian. I think that's a really powerful call, and we look forward to seeing more details about that call for innovators as the details emerge. On the theme of health and safety, I want to turn to you, Bay. As you mentioned in your introductory remarks, you've become a full-time crisis manager, and I know you've been spending a lot of time in your role as a senior leader of human resources for a global company, thinking about what it looks like once your workers can come back to offices. Should they come back to offices? What kinds of protections need to be in place? So I'd love to hear you speak a little bit about what are those questions like? What are you wrestling most with? And also, to what extent you're thinking about the kinds of benefits and supports that your workforce needs, whether those be financial health benefits or other benefits that they need in order to fully return to work.
Thank you, Beth. Look, I think several of the panelists touched upon a couple of things in terms of particularly around the role of employers to help their employees. I think as proud as I am in terms of our readiness for business resiliency, I actually don't believe any company is prepared for a pandemic situation. And it unfolded so quickly in front of us. I'm really proud of how quickly we responded. Speaking of the role of technology, so we enabled over 180,000 people working from home in a matter of days. We saw a lot of innovation and creativity coming out of this period of time. We were able to onboard our new hires virtually, moved all the training online. We're about to onboard our first ever virtual internship classes. If you know the financial banking industry, these are the things in the past would be viewed as just unimaginable. And we were able to do that, all of that in a matter of weeks. While it is true that we can do a lot of things virtually, we also have a lot of employees who whose job just do not allow them to work from home. So we're paying particular attention to these employees, whether it is financially or health and safety perspective. So we made a bunch of policy decisions pretty early on, right? For things like we're paying all of our branch employees on the regular scheduled hours, even if the branch is closed or they're reducing hours. We made a special payment for all of our employees making less than $60,000. For anybody who either had the virus or have been in close contact with the virus, we gave them 14-day paid leave. We gave everybody a 5-day extra time, paid time off just because of the challenge that we're all dealing with. For anybody with higher risk conditions, we asked them to stay home. If they can work from home, that's great. If they can't, we paid them for an entire full 10 weeks. Recently, some of the employees came forward and said they would like to be considered for opportunity internally if they can be redeployed. And we've mobilized a big team of recruiters to help them to get into those jobs. And we have really, really high success rate. So all these are examples that we have been doing in the past couple of weeks. Now, as we think about bringing employees safely back to the workplace, we're doing so much work, particularly around the reconfiguration of the workplace. If you think about our complexity, right? We operate in 65 countries. We have leased buildings, owned buildings, multi-tenant buildings. We have branch, we have investment, we have traders. So they all require very different setup. Just to maintain the 6 feet social distancing, that basically means we have to reconfigure majority of our work locations, which has been the work that we're partnering with the global real estate team to do. We're thinking about air circulation. We're thinking about common space. We're thinking about how to serve high quality food to our employees without the contamination. So from a policy perspective, we're thinking about things like deploying an app called the Daily Health Check to help employees to develop this good habit. Because in the past, it's almost a badge of honor that you come to work even if you're sick. We really don't want people to do that anymore. So that is a pretty big culture change. We have done enormous amount of work in the emotional well-being space. What I found really fascinating is in the first few weeks, people are worried about the health side. As time go on, a lot of the situation on the emotional and stress and domestic violence type of situation show up. So we've done quite a few creative things. One thing worked really well was we facilitated a virtual training, virtual small group sessions just for people all over the world to come together and share that is purely related to COVID-19. In a small setting, people feel very safe and they have the support from the wellness facilitators to help them get through these. So these are just the examples that we're thinking about. We've been really clear with our employees that the workplace they're going to return to is going to be different from the workplace that they left. The one thing that really resonated with our employees was we asked the question about when you come back, for all of us who we call ourselves Return to Work Task Force. For the task force members, the question we ask ourselves is to say, are you comfortable bringing your family members to the workplace? That's the standard we held ourselves accountable to. And I think after probably 10 weeks of intensive work, we all felt really good about that. So hopefully that gives you a glimpse into what we have been doing.
Yeah, thank you. It's a lot, a lot of details and a lot of things that you're considering, but we really appreciate those specific examples. Jamie, I want to turn the same question to you. I'm curious for your reactions to what Beth shared, how much of that is similar to how you're thinking about it at Prudential. And I'd also love you to speak, if you can, specifically, you mentioned in your intro that you, one of the things that you focus on is financial wellness and financial wellness benefits for employers. And you know, we hear in our conversations with employers that our employers are becoming more and more aware than ever about the financial challenges of their workforce and looking at things like savings, benefits, coaching, and other kinds of financial support. So I'm just curious how you've been seeing that either internally at Prudential or you know, more broadly among the employers you work with.
I want to commend Beth and JPMorgan Chase for their approach. A lot of that resonates with me and with what Prudential has done. Getting our workers safe, getting them working virtually, giving them the tools and bringing on people, having internships, the like. A couple of things that specifically resonated with us that we found unique in responding to this sort of environment is granting paid leave for caregiving, and for wellness as well. That is delivering the sort of policies that we think need to be nationwide. We've talked about the need for paid leave nationwide, and really what's come out of the CARES Act on a temporary basis, how do we make it permanent and sustainable and available to all workers? And we see a public-private solution being best there. But we've also realized that one of the big challenges that people had during this environment was childcare. Their schools weren't open and they were trying to do work. And it fell upon often mothers to both balance being a teacher and also trying to work full time. And they found that, they told us they were finding that impossible, but they needed financial help for their caregiving. So we gave a daily stipend to allow for caregiving when it was available. We've also put in place a variety of things around mental health, as Beth suggested, and we're also realizing ergonomics are a key element of being able to work from home. People just aren't set up to work from home. So we've deployed very simple equipment and capabilities to do that more effectively. When we think about the employer's role in financial wellness, we think that that's critical, not just for today, but going forward. In the past, I think that there was this myth that the employer created a lifelong contract and would help you retire. And I think it was a myth because it was never really available to all workers. But today, the workplace in particular has to be the spot where we can gain scale and grow the financial wellness of individuals. And why is that so important? It's important to, I'm not going to even go into why it's important for the worker. I think that case is obvious. But it's important to the employer because even if they don't have a moral case, there's a business case. Workers who are financially well are happier, are more attentive, or more productive, are less absent. When they're absent, they return to work faster. They have less stress. And as a society, workers who are financially well, when we have a growing and healthy and sustainable middle class, and we have a pathway for low to moderate income families to get to the middle class, we have a growing and stable society. So there are as my colleagues have said on the panel, we've got so many workers who are not in the system of working for a traditional employer. We've got to rethink the way that we deliver financial wellness, not just to traditional employers, but to all available workers. And so we've been thinking about things like emergency savings. Now, the CARES Act has allowed people to tap into their retirement savings. And that's because the retirement savings system, the 401k system, is the only thing that was accumulating assets over time. Prudential has partnered with folks like Prosperity Now to come up with solutions about how do we create emergency savings at work using the existing paycheck and payroll deduction of like the 401k. So people can get access to emergency savings quickly. Now, people who don't have access to that need additional solutions. And we've historically in this country, we saw unions oftentimes providing this sort of solution. We need a different environment where unions are not reaching all the workers that the Workers Lab is talking about, for instance. And so we're seeing the growth of associations. That is, individuals with common goals creating an association and creating a purchasing power and creating a buying system where they can fund their own benefits, and people who are hiring them can contribute to the association without tripping over the employment standards. And so we think that there's a lot of work to be done on portable benefits, and there's a lot of innovation and experimentation that can take place.
Thanks, Jamie. I'm glad you brought that up because I'm seeing a similar theme in some of the comments here. Adrian, you talked about the ways in which the system in the 20th century left a lot of workers out. And Jamie, you mentioned the lack of a national paid leave policy. Adam, you've talked about the ways in which some of the supports that are in place now as a result of the crisis are about to expire. Adrian, I wanted to turn back to you, and in light of that, ask you to comment. I know in your work at the Workers Lab, you've been really calling attention to the needs of gig workers in particular, and those that have been left out of the safety net, the traditional safety net of employer benefits. So I'd love for you to speak a little bit more about the holes that you see in the safety net and what you think this crisis means for the future of employer-sponsored benefits.
Sure. Thanks, Beth. I think for us, the bottom line is that the safety net, and the tools available therein simply don't accurately reflect what workers are up against right now. A lot of what Jamie talked about doesn't reflect those things. So where do workers go for help, right? Even before the pandemic, it was clear that the tools inside that net were not only insufficient, in many cases, they were doing additional harm in the lives of workers. And one example I can point to is this pernicious practice of predatory lending, which, by the way, runs rampant in communities of color. And that served as a hypothesis for an experiment we conducted in emergency cash. And actually, we did it in partnership with Prudential and with Steady. That tested what kind of impact $1,000 of emergency cash would make in the lives of gig workers specifically. And we learned a lot, right? But I think the headline here is that $1,000, while helpful in the short term, wasn't anywhere near enough to help in the long term, right? Compounded by things like the gulf between income, the widening gulf, I should add, between income and the cost of living, and a pretty shameful racial wealth gap, all compounding what an emergency actually is. When paying your rent becomes sort of this like monthly recurring emergency for workers, boy, oh boy, right? I mean, think about that. The financial toll, the psychological toll that takes on working families from month to month, it's not good. And we can do better than that, right? And so as it pertains to the pandemic has shown us that for the vast majority of working families, a social safety net, especially when it matters most, doesn't really exist. I mean, just look at the scramble to transfer emergency cash. And thank God for Steady, who we partnered on. I'm sure Adam will talk about what we did there, but the scramble to secure and expand paid sick leave, to administer unemployment insurance. On almost every front, we were woefully unprepared to handle what has happened here. And as the dust settles, Beth, it's becoming really clear who's winning and who's losing. I'll just give the unemployment insurance example. We're seeing very clearly how, and Adam is doing a lot of innovative work here. We're seeing very clearly how deeply concerning the design failures of this system are, how hard it is to access and qualify for unemployment insurance, and how those workers that need it the most are losing out because of who they are and because of where they work. Women is a great example. Women, and in particular, women of color, are being hit especially hard, right? So we know that women make up 2/3 of the lowest paid occupations in this country, right? Essential workers, jobs on the front lines. They're also more likely to work part-time and have those unsteady schedules I talked about. And so they often don't show enough earnings to meet the eligibility requirements for UI. And so it's not fair. And the system has failed to account for these very specific circumstances for the people it says it's designed to help. And so this is a system failure that is not only inefficient, in my opinion, it's incredibly unjust. And as far as the employment benefits go, we're also seeing now that these will only go so far, especially in a crisis, Beth. Ideally, robust, coordinated intervention by our government would step in and pick up the slack. But that hasn't happened either, right? I think most would agree. And so the end result is that workers have and continue to take the hardest hit here. And as big and as ubiquitous as the pandemic is, it, in my opinion, is still only a symptom, right? Like the root cause here is in the deeply flawed design of the systems that should include and take care of all of us. And fixing them is going to require all of us, right? Public and private sector leaders alike, and perhaps most importantly, working people being at the table.
Thanks. I'm going to actually turn it over to Adam. I'd love to hear you respond. I know you at STEADY have been working closely with the Workers Lab, and I'd love to just hear your thoughts on that partnership. And just in light of everything that Adrian just shared, what are you learning about how to best direct resources to the communities of color, the low-income communities that have been most impacted by the crisis?
Yeah, so we were incredibly fortunate to have the opportunity to work with Adrian and his team on this project when COVID struck, just given that we had built a nice relationship pre-COVID on the project you mentioned a moment ago. But what we saw across our 2 million gig and hourly workers was just this massive fall off at the middle of March of income. And roughly 37% of our member population had a income decrease of more than 50%, but less than 100%. Another roughly 27% saw their income go to zero incredibly quickly. And to Adrian's point, there is a massive problem with a large portion of those individuals getting onboarded for unemployment, just given the structure of the system today. I won't go into that today, just given that that's a long separate conversation. But what we became very fearful of as we started digging into the data with Adrian and his team was the racial disparities of that income loss. And what we found was that over 40% of those individuals that fit those two criteria of having more than 50% income loss and those with 100% income loss came from African-American communities. Over 15% came from Latino communities. And if you look at the African-American breakup of the US population, it's 13%. That's nearly 4 times outweighted, right? It's just absolutely frightening. And if you dig in a little bit further, what we also found is just the overwhelming number of individuals that are on unemployment for the first time. These are middle-class families, right? And we have this massive wealth gap, this massive wealth divide. A lot of the low-income earners we found in the gig workers were actually better prepared for the crisis than others, just given that they always have to hustle. They always have to figure things out. It's those middle-class families now that previously relied on a W-2 paycheck who have fixed financial obligations like house mortgage payments, auto payments, who now, first off, unemployment, even with a supplemental CARES Act, is insufficient to meet those financial requirements. And going forward, their job prospects are de minimis, right? And again, heavy outweighting towards communities of color. I think Adrian's point and Jamie's point on childcare also is very well put, in that so many of these individuals, both from a childcare and healthcare perspective now, like they're frontline workers, right? These are people who are being encouraged to go back to work, who deal with people day in and day out. They can't work from home like the rest of us. They have no choice. What are they going to do with their kids? And people are complaining about the supplemental unemployment insurance being more than they would make historically. Well, their kids were in school previously. What do they do with their kids right now? How are they going to pay for that? And then you look at healthcare, and these individuals, a lot of them were getting by with no or very, very limited poor healthcare and avoiding the doctor at all costs. Well, now if you're a frontline worker, how can you do that with COVID, with the chance that you could catch COVID on your job? And so they're having to fund healthcare obligations. So if you just think of this just massive, massive impact on this worker population, both those who are already in financial despair, heavily weighted towards communities of color, and then now those that were middle class were finding themselves in this, and just bringing that wealth gap, at least the upper echelon of that, to a smaller and smaller percentage of the people who are keeping the stock market at near record highs, right? Which is just a massive disconnect. So been very pleased to work with Adrian. I think getting the money into people's hands, as you talked about, it's not a savior, right? I mean, it's not, these people now aren't safe, but it at least fortunately enabled them in a lot of instances to be able to put food on the table, as they showed us in their videos, until they were able to get through the unemployment mess, to be able to do so in the meantime. But again, as we talked about, there's a lot coming over the next couple of months, including even, there was this comment Adrian made, last thing about rent being an emergency every month, right? Well, think about the balloon payments that have been structured for rent payments now. People delaying the rent 3 months. Those aren't delayed for 3 years. They're delayed for 3 months, and there's a balloon coming very soon. And so how are we gonna solve for that, both in rental payments and also mortgage payments? So yeah, I mean, there's so much that needs to be done. In particular, again, I'd continue to highlight just the overwhelming disparity that's happening specifically to the African American community during this time.
Yeah, thank you, Adam. We have just a few minutes left, and I think in closing, I want to bring it back to just the role of the institution, and in this case, employers. One thing that I know I've been thinking about a lot, and others have been thinking about as well, is the extent to which this crisis is really going to accelerate the movement towards a model of stakeholder capitalism, away from shareholders being the most important stakeholder to a model in which companies value and invest in and are oriented towards the needs of all of their stakeholders, including employees, communities, and customers. And Beth, I wanted to give you the last word and ask you to share your perspective. Do you think this crisis is moving us more towards a model of stakeholder capitalism? I'm asking you in particular because the letter that Jamie Dimon wrote last month, updating shareholders and the public on the company's COVID response, in which he called for a model of more inclusive capitalism. I'd love for you to share if you think that we're headed in that direction, and what is it going to take for more companies, more employers to adopt that mindset?
Yeah, absolutely. I think the good news, at least for JPMorgan, is that concept has been a longstanding strategy for us, right? If you go back to the history, you will find whether it's during the hurricane time or even way before that, we constantly talk about being there for all of our stakeholders, which is customers, clients, the communities we live and we serve, and the employees and the stakeholders. So that is very consistent with our long-term strategy. I think this COVID pandemic crisis just further amplify how important it is. Because, Adrian and Adam both talked extensively about the disparity that you see in the society. And I think this pandemic just made it so much more obvious. Financial Health Network, I believe, did the research of only 29% of the Americans are considered financially healthy. I think it'll be probably an even more devastating number after the crisis. If you look at the small business side, less than 50% of them can cover a 15-day cash buffer, which is just astonishing, right? So we're very conscious about all these stakeholders and how do we make more commitments to help them to recover. I think we talk about the all-inclusive economy quite a bit, especially in the road of recovery. I think the government, the policymakers, the employers, whether it's large or small, the individuals, we all have a significant role to play. And I don't believe it's one of those things you can dip in and out. It has to be a long-term commitment. You have to be there. We're not going to be able to make a change overnight, but the more of the employers can lock arms and do the things that we all do, I think that will provide some help. along the way. I see a wrap.
Thank you, Beth. I think we're out of time. Unfortunately, I feel like there's so many more threads I'd love to pull in this conversation. But for now, I just want to thank all of our guests, our panelists for this conversation. Jamie, Adam, Adrian, Beth, thank you for your time and for your insights today.
Thank you.